Hello, today is Friday, March 22nd, 2024. Today, Chile City, there's a naval port city down south of Korea, and they have a cherry blossoms festival, even though cherry blossoms are not in full bloom. I heard that only several trees have flowers bloomed there, but they are going to have the start of the festival today, which is a shame. By the way, since I have a headache, I would like to read an interesting article that might help reduce my headache or brain fog. This article is from Cleveland Clinic. I think that clinic is quite a famous clinic and probably very renowned and professional in what they are doing. So let's delve in and read this academic article so that I could practice English by reading it aloud, memorizing stuff on the spot, and be more knowledgeable about brain-related disease or ailments. So here we go. I have 20 minutes to go before I hit the road to go to my work office. A Cleveland Clinic. Vasospasm, right? Spasm. Some your muscles just twitching, shaking, involuntarily. Spasm. Vasospasm. Yeah, I have some frog in my throat. And I don't know why. Vasospasm is a tightening of an artery that lasts longer than a normal constriction. Vasospasms can happen in many parts of your body, but the most concerning are in your heart and brain. So heart can also have vasospasm, right? The most concerning are in your heart and brain, right? Let me poke my nose with a Q-tip. I took a shower a while ago, but I still have some itchiness in my ears. When your blood vessels is narrow, it reduces the amount of oxygen that reaches the organs and tissues it supplies. Medicines can help all types of vasospasms. Really? With medication? Overview: vasospasm, normal artery, normal blood flow. A narrowed artery, reduced blood flow. Common vasospasm locations: heart, spine, fingers, and toes. A vasospasm or extended tightening in your artery cuts down on the amount of blood that can move through the affected artery. What is a vasospasm? A vasospasm is a lengthy, constricting, narrowing, or tightening in your artery. This reduces blood flow through the artery, sending less oxygen than normal to nearby tissues. Less oxygen than normal to nearby tissues. Your arteries expand and contract their muscular walls regularly to help control the pressure of blood moving through them. Because vasospasms last longer than a normal constriction, they can damage the layers of your artery walls. It's like clenching your fists for too long. Your arteries expand and contract their vascular walls regularly to help control the pressure of blood moving through them. So it doesn't stay at a normal certain state but it contracts and it expands at the same time, right? Because the vasospasms last longer, right, than a normal constriction, they can damage the layers of your artery walls. It's like clenching your fists for too long. Vasospasm is more likely to happen in abdominal areas. What the fuck happened? Right? I didn't touch the camera button, but suddenly it just pops up in my face. Okay, I walked 17,062 steps yesterday, which is not bad. Vasospasm is more likely to happen in normal areas of blood vessels. Endothelial dysfunction. What happens during a vasospasm? During a vasospasm, smooth muscle overreacts to signals to constrict. Normally, these muscles have a temporary response to a signal to tighten an artery wall. During a vasospasm, the muscles constrict longer than they should. Okay, not sure why our body sends that wrong signal, abnormal signal, when it shouldn't. How does a vasospasm affect my body? Vasospasms happen in various arteries, but they happen more often in some arteries than others. These include your heart and brain. A vasospasm's effects vary depending on where they happen. For example, coronary vasospasms, prinzmetal angina, can limit blood flow to your heart and cause a heart attack. A cerebral vasospasm can cause reduced blood flow, leading to cerebral infarct, like a heart attack in your brain. Coronary vasospasms, a cerebral vasospasm. Yeah, I am interested in cerebral vasospasm because it relates to a brain, can cause reduced blood flow leading to a cerebral infarct. Vasospasms in your fingers and toes are uncomfortable. A nipple vasospasm can make it difficult to breastfeed, chest feed. Interesting. Nipple can have also vasospasm. How common is a vasospasm? An estimated 20% of childbearing people may have vasospasm in their nipples during breastfeeding, chest feeding. As many as 50% to 90% of people with an aneurysm rupture in their brain get a vasospasm. Aneurysm rupture. As many as 50 to 90% of people with an aneurysm rupture in the brain get a vasospasm. Okay, so I have to look that up too. Cleveland Clinic is a nonprofit academic medical center. Advertising on our site helps support our mission. Wow, nonprofit academic medical center. We do not endorse non-Cleveland Clinic products or services. Symptoms and causes. Interesting. Symptoms and causes. What are the symptoms? Vasospasm symptoms are different depending on where the vasospasm happens. Coronary heart vasospasms. These happen at rest, at night, in the early morning, and in the cold. Researchers also have linked them to anxiety and depression. Coronary vasospasm symptoms include cardiac arrest or observed sudden cardiac death. or aborted sudden cardiac death, fainting, stable angina, acute coronary symptom, cerebral brain vasospasms. Cerebral vasospasm symptoms include sudden severe headache that gets worse within seconds, drowsiness, inability to move your limb or one side of your body, drowsiness, sudden severe headache that gets worse within seconds, finger or toe vasospasms. Cerebral vasospasms symptoms include sudden severe headache that gets worse within seconds. Not that one. Drowsiness, inability to move your limb or one side of your body, finger or toe vasospasms. Symptoms of a vasospasm in your finger or toe include coldness or numbness, skin color changes, throbbing, or tingling. Nipple vasospasms. Symptoms of nipple vasospasm in those who breastfeed, chest feed include nipple pain, color change in nipples from white to red to blue or purple. I thought nipples are reddish or blackish, right? Purplish, but they are abnormal, you mean? And the nipples color should be white. What causes a vasospasm, right? I need to look at my wife's nipples or my own nipples. What causes a vasospasm? A vasospasms in various parts of your body have different causes. Coronary vasospasm. Direct causes aren't well understood, but conditions and causes that are associated with coronary vasospasm include serotonin, chemotherapy, caffeine, amphetamines, or cannabis. I don't do drugs, genetic mutation, inflammation, migraines, cerebral vasospasm. Cerebral vasospasm causes include ruptured brain aneurysm, other causes of bleeding around your brain, exposure to vasoactive substances or medications, subarachnoid around your brain, blood clot, vasospasm in fingers or toes. Causes of vasospasms in your fingers and toes include Raynaud's phenomenon, scleroderma, atherosclerosis, blood clots, vasospasm in nipples while breastfeeding, chest feeding. Nipple vasospasm causes include Raynaud's phenomenon, certain medicines, breast surgery, autoimmune disease, exposure to cold, unlatching baby, topical antifungals, and all-purpose nipple ointment, APNO cream, poor latch or pump-induced nipple trauma, tobacco use, unknown. Diagnosis and tests. How is a vasospasm diagnosed? A provider's physical exam can be a key part of making their diagnosis, but these tests are important as well. Electrocardiogram, EKG, right? Cardiogram. An angiogram after injecting medicine in your coronary artery to start a spasm. Positron emission tomography, PET, computed tomography, CT. So I've heard almost all of them: EKG, PET, CT, MRI, magnetic resonance imaging, echocardiogram. Very common, those equipment. Yeah. Management and treatment. What is the treatment for vasospasm? Vasospasm treatments vary depending on where in your body the vasospasm is happening. Coronary artery vasospasm. Treatments for coronary artery vasospasm include taking calcium channel blockers, taking nitrates, losing weight, stopping the use of recreational drugs and tobacco products, getting an implantable cardioverter, defibrillator, ICD, if you have ventricular tachycardia. Cerebral vasospasm. Cerebral vasospasm treatments include increasing fluid intake, increasing blood pressure, removing the trigger that's causing vasospasms, giving a vasodilator like a verapamil orally or nimodipine through an IV, intravenous through your vein, rarely giving intra-arterial vasodilators if needed. Vasospasm in fingers or toes. Treatments for vasospasms in fingers or toes include wearing gloves, mittens, and other warm clothes, avoiding the use of tobacco products, taking calcium channel blockers like felodipine or amlodipine, Novask registered or Caterdia registered, having surgery or botulinum toxin injection, nipple vasospasm. Treatments for nipple vasospasms include applying warmth and keeping nipples covered, avoiding things that make blood vessels constrict, such as tobacco use, taking nifedipine, nifedipine registered XL, or Procardia registered XL, a calcium channel blocker, or selective serotonin reuptake inhibitor SSRI is sometimes necessary if vasospasms continue despite above measures, right? Maybe also maybe having a boyfriend or husband sucking on the nipples may help. I think. Side effects of the treatment, it goes both ways. Side effects of the treatment. Yeah, men gets pleasure, women gets treated. Side effects of the treatment. Medicines for treating vasospasms may cause headache, upset stomach, dizziness, lightheadedness, lightheadedness. Seizures. Interesting that lightheadedness it's just one word, not two words, right? Lightheadedness, dizziness, upset stomach, headache, seizures. Care at Cleveland Clinic. So that's it. Our call. I'll stop here.